240 providers we have, but by the public to sign up ahead of time, to be scheduled, to show up for their appointments on time, so that we are as efficient as possible with the delivery of this vaccine. There are a myriad of experts on this that are on this call that will answer your question. And I know that this process is going to continue to go, but I just want to caution everybody that this is a dynamic process. It's dependent upon how much vaccine comes in, depends upon how people sign up and show up to get their vaccine. We have got a lot of different options that we're exploring in Idaho. With that, I'll turn it over to Director Jepson, who will put a lot more detail into our vaccine plan. Dave?
Well, thank you, Governor. I appreciate that. I appreciate all you're doing in this pandemic response and on the vaccine in particular. I just want to reiterate that from a Department of Health and Welfare's perspective, we are committed to communication and transparency and data, and have been from the very beginning of this pandemic. We have the COVID dashboard that's up and running right now on our website that gets updated periodically as more data becomes available, more types of data become available. We've been running our Facebook Live page, our broadcast each week, as well as our DHW blog. And this new weekly press briefing, specifically around vaccines, is a continuation of that commitment. And I did want to take the chance to announce that we will have a COVID-19 vaccine dashboard coming this week. Right now, you can see the number of vaccines administered on our landing page at coronavirus.idaho.gov, but we will actually have a Tableau COVID-19 vaccine dashboard coming out later this week. I definitely think that the arrival of this effective and safe vaccine is a real turning point. It's actually a modern science miracle, frankly, of how quickly and effectively and safe this vaccine has come together, and we're very thankful for that. And we are committed to roll the vaccine out in as safe and as quick a way as possible. And I just want to reiterate that. We want to make sure we get the vaccine out in as safe and as quick a way as possible. We know that there's many in the public that have the question of, when can I get vaccinated? And where do I go to get vaccinated? When is my turn? To help with that, we have placed on the coronavirus.idaho.gov website an estimated timeline that lists out the various groups that have been proposed at the national level and are being discussed here at the state level, with our best estimate of when vaccine might start for those groups. And that may change as we get more information. There's a lot of assumptions in there, but that's our best information right now, and the best place for individuals to go to answer that question, when can I get vaccinated? The next question that the consumers have, or the public have, is, well, where can I get vaccinated? And that's going to be a little bit different for each priority group, but the short answer is really the normal places that you would go to get vaccinated, whether that's your doctor's office or your pharmacy. We'll be also looking at employer clinics, especially for those critical infrastructure jobs. That's essentially what's happening in the hospitals now, is we're doing them at the employer. Local public health districts will be offering vaccinations in local pharmacies. And so the answer to the question of where am I going to get vaccinated in its simplest form is at the usual place that you would go to get vaccinated. I do want to issue a big thank you to all those medical providers who are administering the vaccines right now. This is not your typical vaccine administration effort, and we appreciate all of their commitments to being fully trained. There was a lot to learn in a very short period of time over the last 3 weeks, setting up the operational processes to support safe administration of the new vaccine, including the ultra-cold storage that it requires, as well as making commitment to reporting the data so we know what's actually happening with the vaccination. As of today, there have been 20,843 vaccines administered over the last 3 weeks in just a few days. This has definitely been a startup process for administering these new vaccines, as I just mentioned, and we've seen an increase in the number of vaccines administered each week, with an increase of 43% in from week one to week 2, and an additional 30% increase in week 3 from week 2. Those increases happened in weeks that were essentially 4-day weeks with Christmas and New Year's, and we expect that number of doses administered to continue to increase. In addition, Idaho's allocation of vaccine doses is being shipped. I wanted to mention that Idaho's allocation of doses is being shipped directly to enrolled healthcare providers and local public health districts. And we've actually activated the Federal Pharmacy Partnership for Long-Term Care Program. What this is a partnership at the federal level with Walgreens and CVS to vaccinate staff and residents at long-term care programs. To activate this, we had to divert some of our allocation of doses to that program and take a couple of weeks to get enough built up to start the program. And those vaccinations started on Monday, December 28th, just a little over a week ago. We anticipate that over the course of this partnership, we'll transfer 33,150 doses over to Walgreens and CVS to immunize staff and residents at long-term care facilities. For those long-term care facilities that did not opt into the federal program, they still have the option to work with their local health district, local pharmacies, and local healthcare providers, and they're coordinating with their local public health districts. Finally, I just wanted to emphasize that this still remains extremely important that we all wear a mask, that we maintain 6 feet of distance between non-household members, and wash our hands frequently. Those items have been used quite effectively over the last couple of weeks, and we're seeing a positive trend in our numbers. We're not out of the woods, but a positive trend in our numbers. And particularly as we get ready to go through the vaccination effort, it's more critical than ever that we follow those simple precautions. And with that, I'm going to hand it off to Division Administrator Elke Schatz-Holik, who will give some additional information about the vaccine distribution program, and then we'll take your questions.
Thank you, Director. As the Director mentioned, I would like to provide a little bit of an overview on some process logistics type stuff and walk you through a little bit of the process about and some information about the priorities and a little bit about the doses that we've administered so far. I think it's always important to have a little bit of grounding just to make sure everybody is on the same page about how this process actually works. So I want to just, at a very high level, just give a little bit of the basics. As you all know, the federal government procured doses of vaccine for the states to use. And it's the state's responsibilities then to receive those vaccines in the amounts that are allocated by the federal government. And then our role is to subsequently then to get essentially shots in arms. So vaccines that are allocated, as the Director mentioned, go directly to the enrolled providers from the manufacturer. The state, in partnership with local public health districts and private providers, have been getting ready to bring these vaccines into the state by enrolling providers who can administer the vaccines, going through quite a bit of training with providers on safe handling and use of the vaccines, excuse me, and as well as our vaccine inventory and registry system. And we're also working with our the Idaho COVID-19 Vaccine Advisory Committee to recommend our phased approach to the governor. So in essence, the federal government provides states with the vaccine, the states lay the groundwork, enroll and train all of the providers, and then maintain that robust tracking system as vaccinations are being administered to people in Idaho. And of course, we want to take a moment always to celebrate our first vaccine that was administered. The first dose was administered December 14th, which was almost exactly 9 months after the first case was reported in Idaho. I like to celebrate that every time I get the chance because I think it was just a really great step for the state in helping us move forward with the pandemic. I want to talk a little bit about the priority groups. I know that they're of a great deal of interest. And as you know, each week we've been getting vaccines shipped into the state directly to those providers, and they're focusing right now on that first priority level in our phased approach due to the limited vaccine supply. The current phase that we're in right now, or this first phase, it's sometimes referred to as phase 1A, that's the phase that CDC has designated for it, is for healthcare personnel, long-term care facility staff, and their residents. Idaho in general has been following CDC's priority groups, and our Idaho COVID-19 Vaccine Advisory Committee, or CVAC, reviews CDC's priorities, and we've been making recommendations to the governor based upon the sub-priority groups within those groups. And to date, CVAC has ranked healthcare workers, long-term care facility staff and residents, as well as essential workers. So you have that larger phase and then subgroups within each of those phases that our CVAC has been weighing in on. Recently, as you are probably well aware, CDC made some additional recommendations that impact the phase after this first phase of healthcare workers and long-term care staff and residents. CVAC will be taking up those recommendations this Friday at our committee meeting from 12 to 2. And that will include those new recommendations from CDC about the next phase, which they call phase 1B, to include frontline essential workers as well as people over the age of 75. So our group will deliberate over that and make some recommendations to the governor on Friday. The state and CVAC members have received a great deal of input. We're getting input through our public portal. I know many of you participate in our bi-weekly meetings that we have with CVAC, and you are familiar with the fact that we have that portal. So we've been getting a lot of input on clarifications to subgroups within those phases, as well as requests for changes in rankings and just additional input. So we've been providing all of that input to our CVAC members. So they have that with them as they are deliberating the input that we've been receiving and making their votes, and then subsequently recommendations to the governor's office. So as the director mentioned, the state opted into the federal long-term care pharmacy program. We are, as he mentioned, working with the federal program with our allocations. They're just getting underway, so limited vaccines at this particular point in time have been given. And we also, as the director mentioned, if those long-term care facilities did not sign up for the federal program, they're participating with the local public health districts and local partners to administer those doses. So speaking of doses, I wanted to give you a little bit of information about that. So we have received to date, since this started, 83,475 doses. And as the director pointed out, we have 20,843 showing on our coronavirus site as administered. 67,875 of those doses that we've received were for the first doses. We received those in December and an additional receipt in January. And then we also received 13,650 second doses in January. And then in addition to that, because we are supporting the pharmacy program, we also received 15,600 doses for the pharmacy program. So in total, the state has received, and I say received because remember, all of those doses go directly from the manufacturer to the enrolled providers, and they have received those doses. So, you know, as you've seen over the start of this, as we started receiving doses, it was a little bit inconsistent in the numbers of doses that we would receive from week to week. We have been told that we can expect to receive approximately 20,000 doses each week in Idaho moving forward, and that we'll have that consistency. So with every 20,000 doses that are coming, we have another 20,000 doses that are being held for the second round of doses, and those will be shipped approximately 3 to 4 weeks later, depending upon the vaccine that it's for. As the director mentioned, on our website at the coronavirus.idaho.gov, you can track those doses being administered. We do want to note that there's a difference between the doses distributed and administered, and I want to pause and acknowledge just a few things about that. Of course, you know, our first priority is always to ensure that we have a proper handling, administration, and tracking, especially for that second dose of the vaccine, with the goal of vaccinating every Idahoan who wants a vaccine in an efficient and safe manner. But it really does take time for when that vaccine arrives in the state at the enrolled provider's office. You know, they have to receive that vaccine, they have to set up their vaccine clinics, make appointments, train their providers on how to give those shots in an environment that's conducive to being able to observe them, be able to observe physical distancing. So there's lots of logistics that go into just setting up those clinics and making sure that they can give those shots. And then there can also be up to a 72-hour delay between those doses, when the doses are administered and then when they come into our database, and then we can then put them out on the coronavirus site. So, and then lastly, you know, we also have to remember that we did go through this holiday period, and some of those shot clinics were closed or had limited hours during that time. but we fully expect that the number of vaccines administered are going to be rising in the coming weeks. We're going to be getting more in the state. Providers are more proficient in the way that they're doing these vaccine clinics. And we feel very pleased with how the vaccine clinics are going and very pleased with how the doses are being administered, and very grateful that we have so many providers enrolled and willing to do this work. So in addition to tracking the number of vaccines in total, as the director mentioned, we are going to continue to enhance our dashboard on the coronavirus site to show geographical data. We'll be able to, down the road, show first and second doses administered and much more. We are going to continue to evolve that site as we have more information. So keep an eye out on that. In summary, we will be continuing to work with our advisory committee to help make recommendations to the governor on the phases and those priority groups. We are going to determine the decision points that will help us guide us in moving from one phase to the next. For example, moving from that phase 1A or the healthcare worker phase to the essential worker phase. We'll continue to enroll as many providers as possible to support vaccinating all Idahoans who want the vaccine. Local public health districts are helping us with this. We're absolutely thrilled and thankful for all those healthcare providers that are doing this for us. But we really want to make sure that we're also ensuring that vaccine is not going to waste. That every vaccine that comes into the state is being as quickly as possible put into the queue to be administered and being administered and used correctly and safely. We also are working towards our communications about when people can understand and know what phase they're in, where to get that vaccine, and when we move from one phase to the next. So lots more of that will be forthcoming as we move in the coming days and weeks. So my last note is that we have vaccines being administered safely and effectively across the state. Providers are taking the time to train their staff, address all of those logistics. They're doing a fantastic job. There are going to be bumps in the road, absolutely, as this is rolled out, because no one has done this before. These are different vaccines. There's a lot to learn. And of course, we appreciate the public's patience and cooperation as we go through this process. But most of all, I want to express my sincere excitement that we finally have this vaccine here, and appreciation, and that this is a great beacon of hope for the state. And in the interim, as always, as the director said, I can't leave any of these without saying how important it is to continue to do the things that we need to do, wearing our masks, staying physically distant from one another, not letting our guard down at this time, make sure proper hand hygiene, because all of those are vitally important until we can get to the point where we have adequate immunity to the virus. So with that, I will end my note.
All right, thanks, Elke. So we will now take vaccine-related questions from our media participants. We're going to answer as many questions as possible in the time we have available. Please raise your hand in WebEx by selecting, you kind of have to hover your mouse over to the right of your name in the participants list. You can select your hand to raise your hand. You can also type your question into the chat area, which you can access in the lower right part of your screen. And we also ask that you announce your name and media outlet before asking your question. So with that, I see Clark Corbin was first. I'll unmute you, Clark, and you can go ahead and ask your question.
Hi, thanks so much. This is Clark Corbin with Idaho Education News. I want to thank you guys for doing this today. I wanted to find out a little bit more about the vaccine rollout for educators. I know from Director Jepson's call with the governor earlier today that they're looking at early February, and they're in that kind of 1B group. But I do know of a handful of teachers who have already received vaccination. So I wanted to find out a little bit more about what our educators and K-12 staff can expect, and specifically, how will they get the word? If you're teaching 4th grade in Homedale, how do you find out that it's your turn and your vaccine's available? So thanks so much.
Great. And I'll go ahead and answer that, Clark. Thanks for the question. You know, with the way the vaccines are being rolled out, you know, we definitely want to stay as true as possible, and we are asking our providers to stay as true as possible to the phase in which we're working on. And as you noted, teachers and school staff are not in this initial phase, but we do know that some providers have given those vaccines out there. They are in the next phase. We do see them as coming up very quickly as we transition from group essentially 1A to group 1B. However, we also, given that we can't police every single provider that's out there giving vaccines, we are educating, we're doing our best to make sure that we're staying consistent as we can across the state. So I think that's part of that bumpy factor that I was talking about. That it's not going to be perfect, it's not going to be completely uniform, but we're trying our best to help providers stay as consistent as possible.
And then real quick, how do you find out when it is your turn? If you're teaching, you may not be in Boise. If you're teaching in Rexburg or Homedale, how do you find out if you're a K-12 employee when it's your turn?
Great, thank you. I neglected to answer that part of your question. So we are working with our local public health districts and the enrolled providers and our CVAC group, of course. So we can start anticipating when we can be through one phase and ready to proceed into the next phase. And as providers are getting ready to do that transition, they will also they'll be doing a reach out. We'll be sending out communications from the state. We'll be working with our local public health districts so we can try to get those announcements out there. Our hope is to be able to, give it, let's say a week's heads up, if you will, that a next phase is going to be approaching. So those providers should be working with different population groups as well. And I will, we also have Dr. Christine Hahn, who is our medical director, and Sarah Leeds, who is our immunization program manager, on the call as well. So I'm going to see if there's anything that Sarah would like to add to that response.
Thanks, Elke. Yeah, I think that all the methods that Elke talked about are the ones we're going to use, and working with our Office of Communications to amplify that message as much as possible. We will certainly be communicating with our vaccinators so they know, and using social media and all of you all, the media who's on this call, to help us get that word out.
Thank you, Sarah.
Okay, and then when you're done asking your question, you have to click on your hand again to unraise it, if you could do that when you're done. I saw a hand from Bree Clark. Bree, I'm going to unmute you. You go ahead and ask your question.
Okay, this is Ruth Clark with Local News 8. So I had a quick question. I know that there was quite a little bit of a delay in the rollout, and then a fewer number of doses than anticipated. Do you all have any plan to kind of make up for that loss moving forward, or are you all just moving from where you are currently forward?
Bree, this is Elke. I'm going to have to ask you to repeat the question because we're having bandwidth issues, it looks like, and you were cutting out a little bit. So I want to make sure I'm hearing the whole question.
Sure, absolutely. So my question is, I know that there was a little bit of delay in the rollout and a fewer amount of doses than anticipated that you all received. Do you all plan to make up for that or move forward from where you are currently?
I'm going to take the first swing at that, and then I'm going to turn it over to Sarah Leeds. Yeah, that was part of our initial conversations with the federal government, is that we were anticipating a certain number of doses, and then indeed our allocations were less than what we originally anticipated. And we're hopeful that as manufacturing increases over time, new vaccines come onto the market, we'll be able to then have more vaccine available in the state. We don't know, and this is why I would like Sarah to weigh in, I don't believe that there's any promise that that original dose amount that we thought we were going to get will be made up in a future shipment. I think it's just as production ramps up across the nation, they'll start redistributing, or they'll start distributing those doses as they can by population.
Yeah,
anything you want to add to that?
Sure. Thank you, Elke. The immunization program, we have meetings twice a week with our connections with, our project officer at CDC and our Operation Warp Speed liaison. And there have not been discussions about quite making up for those doses that were originally talked about. They were given to us as estimates and planning, and then later reduced, as you all know, from last month. But we have been told that we should expect, and all states should expect, to see a regular cadence of distribution, at least for the time being. And that is that number that Elke talked about, right around 20,000 per week. And we certainly do communicate with them that we would like to see that increased, as I know all the other states are doing the same.
Okay. And so with that, are you all, just a follow-up to that, with that, are you all still on target when it comes to the second dose that needs to be administered for this vaccine?
I'll take that. So with every dose that comes to us, the federal government holds its second dose partner. So it's not that we have to make up for those amounts coming. They are controlling, if you will, they're holding for us that second dose that will be on its way.
Okay.
Okay, thank you. Now we're going to go to Keith Ridler from the AP. I'm going to unmute you, Keith, and you can ask your question.
Okay, thank you. A question for Governor Little. Just looking at some of the numbers here, an expectation of 20,000 doses per week. My quick math shows that's about a million doses for a year. They're 2-shot doses. I might be getting something wrong here. So that's about 500,000 people vaccinated in a year. Idaho is about 1.8 million people. It doesn't seem like there's any way Idaho is going to meet its timeline as set out by the Idaho Department of Health and Welfare to get vaccinations out. Governor Little, can you talk about that a little bit? Is Idaho going to get enough vaccine to fill out that timeline? And are you satisfied with the federal government and the amount of doses Idaho is receiving?
Hi, Keith. I think Governor Little he gave some opening remarks and then he had to step out.
Oh,
sorry about that.
Whoever wants to answer that then.
Director, do you want to?
Yeah, I'm sorry, I didn't mean to speak over you. Yeah, Keith, I'll go ahead and take a swing at that for just a second here. Yeah, I just want to emphasize a couple things. One is that is a lower amount than we were anticipating, as you articulated so well. So thank you for that, Keith. I do want to emphasize what Elke said, which is it's 20,000 a week plus the 20,000 they're holding back for that second dose. So it's a little bit better than you articulated there, but it's still behind what we were expecting. Our hope is that two things happen. One is that production ramps up more quickly than expected of the existing vaccines, and there is some hope for that. But at the moment, they're saying 20,000 plus the 20,000 for the second dose per week at this point. And then the second is we are expecting additional vaccines to be approved. AstraZeneca and the Johnson & Johnson vaccines are pretty far along in their clinical trials. We don't have a precise estimate of when they come on, but we anticipate that will greatly increase our allocation as well when that happens. And so to the question of do we wish it was more? Yes. Do we have conversations with our federal partners about that? Absolutely. But that's where we are at this point, and those are the things that could happen in the future that could increase our allocations that we get.
Okay, thank you.
Nikki, I think you're muted there.
Thanks. I was too busy unmuting somebody else. Sorry about that. I just unmuted Ruth Brown. She's got a question and her hand up.
Hi, good afternoon. This is Ruth Brown with the Idaho Statesman. My question is, what guidance are you giving local health districts or vaccine providers on what to do if they have an extra dose, are they required to follow the rollout priorities, or can they just give the vaccine to anyone available? I ask because, as you know, there is an expiration date on the vaccine. So can you talk to me a little bit about the guidance you're giving providers and local health districts?
Yes, absolutely. Thanks for the question. And of course, we'll continue to tag team, I'm sure, a lot of these responses. We are working very closely with the local health districts and all enrolled providers. And as a matter of fact, we send out communications to them regularly. Sarah's team does. Along with that education about what phase we're in. As I mentioned earlier, one of the things we really want to prevent from happening is any sort of wastage of vaccine. So as providers are working their way through that phase 1A, of course, we want them to stay as close to that path as they can, and starting in that ranked order that we have laid out for them. But certainly if they find themselves in a situation where they have doses that may be expiring, we don't want to waste anything. We would like them to work with their local public health district to see if there's someone very near them that could also be using those vaccines, and sort of do that recalibration of what's happening in the moment. But those phases are fairly fluid. We don't want to necessarily move from phase 1A and have somebody jump over to phase 1B, as I talked about earlier. But if they're really struggling if they're finished with all, let's say, their hospital staff and they're ready to move on, then certainly start looking within that first ranking of 1A. So that's what we've been working with them on, and having it's a continual need to do this education and make sure that people are aware of that fluidity in that phase.
Oh, Nikki, I think you're muted. But I see your lips moving.
Sorry about that. Ruth, did you have a follow-up, or did you have your question answered?
I did have a quick follow-up for Elke. Have any of the vaccines so far, have you seen any go to waste that expired before you could find an appropriate person to vaccinate? Any person, I suppose.
I'm not aware of any at all, and I'm going to have Sarah confirm that.
Thank you.
So I just spoke with our vaccine operations manager about this yesterday, and we have had very, very few reports of any wastage. And I don't have a number, but it has been very minimal, and we consider this a huge success. This vaccine has so many complexities with storage and handling, and our providers have done a fantastic job of not wasting it.
Okay, thank you. I'm going to go next to Melissa Davlin. Melissa, I'm going to unmute you.
Thanks so much, Nikki. This is Melissa Davlin with Idaho Public Television. And I think this is probably a good question for Elke. One of the things we've noticed as reporters is there isn't a uniform blanket data submission requirement for COVID data for the 7 public health districts. Not all of them submit on Sundays, for example, and they submit at different times. So as we get ready to see the new vaccination Tableau dashboard, what can we expect as far as reporting from the providers who are administering the vaccine?
Great, thanks, Melissa. I'm actually, once again, going to hand that over to Sarah because we do have the immunization registry that has all that data that gets put onto the coronavirus site.
Yeah, thanks. So we will be getting daily numbers from our immunization information system and posting them on Tableau. And we see this as an evolution of data that we present. So what we will start out with this week is data on total doses administered, and then breaking it down visually also with numbers by health district, and then also by county for doses distributed and also doses administered. And then there'll be some trend, there'll be a tab for some vaccine trends. And then once we have more data, I see us being able to produce more analysis on some things.
And maybe I'll add to that a little bit because Melissa, I'm assuming that you're concerned also about any lag time between when the dose is administered and when we have it on our site. And there is, as I mentioned in my presentation, can be up to a 72-hour delay between when the provider administers that dose or gives that shot, enters it into the system, and then it can come up into our system to be posted. So there will be a bit of a delay in some cases.
Okay, I'm going to go with Rachel Cohen, I believe at Boise State Public Radio. Rachel, I'm unmuted you.
Hi, yes, Rachel Cohen with Boise State Public Radio. I was wondering, is the state tracking how many people in priority group 1A are declining the vaccine when it's offered to them, and why they might, the reasons they might be declining the vaccine? And if so, is there anything you can share at this point about vaccine acceptance among this group?
Sarah, would you like to take that one too, or Dr. Hahn?
Yeah, I'm happy to take that. Oh gosh, let me start sorry. I've been lurking here. Yeah, so right now we don't have that information, but we're absolutely asking for it because obviously we have these two groups, which is healthcare providers. They've mostly started in the hospitals. And then we have, of course, the long-term care effort that just started just last week. So it's very new, but we are going to be asking, especially our hospitals and other facilities for, what we're hearing about right now is people flocking to get the vaccine. Many of those healthcare providers that are working in the hospital settings have been very eager to get it. But we want to know why, how many don't and why those that don't. We know with the flu shot every year, hospitals don't achieve 100% vaccination. So we know there will be some declining. But we do, it's a great question. We absolutely want to know that information to help us figure out whether, targeted education or other information could be helpful. Nikki, I don't know if you're talking, but.
Yep, no, okay. All right, next we'll go to Joe Parris. I'm going to unmute you, Joe.
Thank you. Kind of relaying off of the percentages of people getting the vaccine. For right now, first, what is the goal of how many Idahoans, percentage-wise, the state hopes gets the vaccine when available, in terms of it then being a meaningful vaccine where you could achieve some type of herd immunity?
Joe, you're really muted. Elke, were you able to hear that question?
This is Chris. I was able to hear it. I'm happy to take a stab. Elke, I don't know if you were able to hear it, but Joe was asking about kind of what's our goal or target, considering we really want to achieve herd immunity, right? We know we'll never get to 100%. Never mind the healthcare worker, just in the general population, we'll never get to 100%, and we don't think we need to be at 100%. You probably know that what is herd immunity has not been firmly established with this virus, particularly now with this more potentially contagious strain now being more widely spread in the United States. That could potentially push that number up. So I think a month ago we were thinking, okay, maybe 60, 70%, and now what we're hearing is, depending on how truly more infectious this new strain might be, we might be needing to get more towards 80 or 85% to achieve a herd immunity across the population. But I would just say for right now, that is fluid, and we are going to, for now, just keep vaccinating and keep watching that the information coming in about what we need to do. And of course, we always have to remember, just like we do with other vaccine preventable diseases, that population-wide immunity, still you can have pockets and of unimmunized folks that can still spread an infection, and how can we try to reach out to some of those groups that we know might be hesitant and try to encourage them to consider vaccination.
To follow up, is there some time of a timeline or a goal of to when, I guess, a suitable amount of people would be vaccinated? And I also wanted to add, there's been a lot of conversation about where people are in the different waves, notably people age 65 plus. How do you balance, I guess, the conversation of those most vulnerable and those most likely to spread the virus in terms of that percentage population?
Yeah, Joe, as Elke has said, that's one reason we have our advisory committee. These are not easy discussions or decisions, and we know that people's opinions will differ. I've been a part of very intense and hard, very deeply felt discussions at the national level about this, and we know in Idaho we'll have the same kind of feelings about whether seniors or essential workers or other groups should be next in line. And that is why, as Elke mentioned, we'll be bringing this to our advisory committee on Friday. I think it'll be a lively and heartfelt discussion on Friday, whether we're going to follow the CDC's path that they've charted forward, which would be 75 and older plus frontline essential workers, or whether the committee feels like we need to go a different way. And I think you had asked in the beginning about a timeline. We had a very good discussion this morning with the director about this very topic. We all agreed we would love to be where we'd, that herd immunity effect or somewhere where we feel like we're in a good place. I think the director proposed August, but we're going to be so limited by if we can't get enough vaccine, we might not be able to achieve that. So we have to do everything we can with the vaccine that we do get.
And real quick, I just wanted to clarify that timetable that came out, the graphic that I know a lot of people have shared noticeably on social media. That's not like written in stone, correct? That's subject to changes as we go through this?
Correct.
Absolutely.
Thank you.
Joe, this is Director Jepson, if I could just emphasize that point. We want to share with everyone the answers to the questions, the best answers we have to the questions of when can I get vaccinated. But we just need everyone to recognize that there's a lot of assumptions in there, including how much vaccine we get in the state, uptake rate, all those sorts of things. And so that could move around. And if CVAC, the Coronavirus Vaccine Advisory Committee, goes a different direction and the priority groups are, that could also change things around a bit as well. That's the best information we have right now. But really have to emphasize that could change as new information comes in.
Okay, next we'll go to Betsy Russell. I'm going to unmute you, Betsy.
Thanks, Nikki. So today in the governor's AARP call which Director Jepson, you were involved in as well, there were really vehement objections raised to the very graphic that Joe just referred to that shows that before people 65 and older in Idaho are eligible to start getting vaccines in April, we would start in February with a group that includes food processing workers, grocery and convenience store workers, Idaho National Guard, people who are non-medical, and other essential workers. From the discussion that I've heard so far, it sounds like CVAC is going to be considering this on Friday. That February group now includes adults 75 years of age and older. Is CVAC looking to lower that to 65, or are we going to do all of those different types of essential workers before we get to those 65 and older in Idaho who are the ones who are dying?
Betsy, that's a great question. That's exactly what we're going to be asking them to weigh in on. As I think I can't remember if it was in this conversation or a different one. We do know that some states have, excuse me, have moved away from what ACIP is recommending or CDC is recommending and doing their own thing. For example, opening it up, instead of being age 75 and older, they've dropped that age group down to 65 and older. So there's room for states to do, to do something different than the federal recommendations, but that's what we're going to be taking forward on Friday.
And Elke, would that include potentially moving the 65 and older population maybe ahead of the group of essential workers, or would they all stay in the same group if Idaho decided to depart from that?
If we decided to move, if CVAC recommended and the governor approved that we would move down to age 65, then they would be in that same grouping And we adopted ACIP's recommendations, for example, that also included frontline essential workers. So frontline essential workers and that kind of age grouping would be kind of equal in the phase. And Chris, you were part of it, like you said, very lively discussions, or Dr. Hahn, excuse me, very lively discussions in ACIP. If you would like to add some of the color that occurred in the conversations at ACIP around this.
Yeah, first of all, thank you, Betsy. You're absolutely right. First of all, I will say the advisory committee could decide that they want to put 65 and older before those frontline essential workers. You know, we're going to present them with the information and the option and then have a discussion. You may be aware that on the CDC's website, you can see all the slides of all the presentations that have been done on this topic over the months, really starting back in June and July. Many conversations looking at how do you save the most lives? How do you keep the economy going the best? How do you keep reducing inequities? You know, all the different goals that we all agree are important. How do you try to get them all done in the same way and in the best way possible? So we're going to give CVAC options. We may say this is why we might want to consider this one or that one, but really it's going to be that committee that's going to be telling us their recommendations.
Thank you.
Okay, I have a question in the chat here from Craig Northrup at the Coeur d'Alene Press. Essentially, he wants to know, how will health and welfare reach out to people that don't fall under their employer or healthcare facility blanket? How will they get notified when it's their turn to get the vaccine?
Yeah, thanks, Nikki. I think that goes back to the comments we're making around the importance of us being able to get messages out through, our communications office, social media posts. I think there's we need to employ a lot of techniques, if you will, to make those announcements from when we're transitioning from one phase to another.
All right, thank you. And I see, Joe has his hand raised again. Joe, I'm going to unmute you. Joe Parris.
Sorry, I forgot to put my hand down. I had my question answered. Thank you.
Okay, thank you. So I see Betsy has her hand raised. Betsy, I'll unmute you. Are you? Oh, no.
I also forgot to put my hand. Sorry.
I see Melissa Davlin did put her hand back up, so I have unmuted Melissa.
I did. Hi again, Melissa Davlin with Idaho Public Television. I was wondering if anyone could give us some insight, perhaps Dr. Hahn or Director Jepson, on when children might be eligible to get the vaccination.
Yeah, I'm going to actually let Dr. Hahn answer that question, but the irony of you holding your child while you ask that question is not lost on me.
That's right.
He wouldn't stop crying unless I picked him up. I'm so sorry.
No.
No. And I have to say, I did thoroughly enjoy getting to know your son through these video calls. So thank you very much. But I'm going to let Dr. Hahn answer the question.
Sure. You may know, Melissa, that right now, the only two authorized vaccines in the United States for COVID are only authorized for the Pfizer vaccine is for age 16 and above, and the Moderna for 18 and above, right? So for right now, we don't have a vaccine for children, essentially. However, those companies are doing studies in children, clinical trials right now in children. What we'll do is wait for that data and wait for that information. But for right now, obviously, we're just going to have to focus on the groups that we have the vaccine for. I have not, and to give you as specific I can, I have not heard a timeline yet for by March, they'll have the data to apply for approval for those age groups. I have not heard a date yet.
I thought, Melissa, did you have a follow-up question? Okay. All right. Let's see. I've got a question here in the chat from Nancy Butler, who does the website Window in the Clearwater. She wonders, she's asking specifically about numbers of vaccinations in north central Idaho, and especially Clearwater County, but I know we don't have those numbers handy right at this moment, but maybe you can talk a little bit about some of the data that we might be able to provide later on the dashboard.
Thanks, Nikki. I'm going to
Sure.
ask Sarah.
I can take that. Yeah, we can certainly, we will be able to, and I believe our time, well, it is definitely later this week where we'll be launching that dashboard, and it will be at the county level. So Clearwater County, any county, there'll be doses administered through, it'll show up in the morning, and it'll be through the previous evening, cumulative.
Okay, I see Melissa Davlin has her hand back up. Did you mean to leave that up? Nope. Okay. I do have another question from Audrey Dutton at the Statesman in the chat. She wants to know, where do people who don't fall neatly into these groups get vaccinated, like a university professor with high-risk health conditions?
I can take that. I know that the director mentioned that in his opening remarks, that people would get their vaccines at their basically their usual source of care. So if that professor had a primary care physician, and it's a time frame that lines up with whatever category they fall into, then they would work on that through their usual source of care. Or the health districts are also offering vaccine. Hospitals, depending upon where you are, might start opening it up to the general population in different phases. So we encourage them to just continue to look. We're also hopefully offering soon a site where you can go and register. And Sarah, I'm going to have you maybe give like a tiny little description of what we're hoping to be able to provide through PrepMod and a public-facing kind of place where you can go and enter your name and get some information back on when things might be available for you.
Yeah, for sure. So the state of Idaho, the immunization program, purchased a pandemic management tool called PrepMod, and many states are using it for both influenza this year and also COVID-19 vaccine. And so it's a tool that we have the license to for now and through the future. And so it will be, the state of Idaho paid for it, and it will be available to providers, healthcare providers, and also the public. And so there's two faces to it. So providers can use the tool to set up vaccination clinics. It will be a tool that is really excellent for mass vaccination clinics, and to organize those and have folks enrolled in and have appointments set. And this is particularly useful for COVID-19, where the management of it really needs to flow efficiently and be different than most mass vaccination clinics, where we have pictures of people waiting in lines, and we obviously don't want that, we want to avoid that as much as possible with COVID. So to keep people socially distanced and timed appropriately, so that there are not a lot of folks waiting in line, this tool will allow clinics to set up vaccination appointments by station. And then people can also, the general public can use the tool to find clinics and kind of sign up and get alerts for when there will be a clinic, when it's kind of their turn. And we are about to launch that. So, more to come. I anticipate that one of these next weekly briefings will highlight that quite a bit as we move out of phase one. But it's going to be a great tool for our providers to use to be more efficient and manage those complexities of socially distant, the wait time, manage that wait time after vaccination in ways that are helpful and efficient.
Okay, I am not seeing additional questions from the media at this time. I have seen several questions in the chat just about when and where people will know when to get vaccinated, which I feel like we've already answered. So if there are no additional questions, did I see a hand here? Erika Lee, I'm going to unmute you.
Hi, this is Erika Lee from KBOI CBS 2 Boise. I'm not sure if you already answered this, and if you already did, then you can disregard it. I've been reading a lot about healthcare workers declining the vaccine. Is that something that, you know, when that happens, you guys recommend that they do it in terms of education, or since they are on the front lines, and when they do decline, do you redistribute or keep a tally of, just to make sure it doesn't get wasted?
Yeah,
do you want me to take one?
Oh, sure. Yeah, Dr. Hahn addressed it briefly, but Sarah, if you want to go ahead, just a quick recap of it. Sarah, are you muted?
Or somebody's muted.
Oh, that was me. I'm sorry. I got the second part of the question, but could you repeat the first part?
Hi. So I was just asking about healthcare workers declining the vaccine and what the response is.
Thanks. So we don't have, like Idaho's immunization information system, we don't track declinations. So what we're getting is anecdotal. We talk to our providers. The immunization program talks to providers daily as they are asking questions, or as we have questions of them as they administer not only COVID-19 vaccine, but all routine immunizations. And so we are hearing, the theme that we're hearing is that providers who had originally said they would not take the vaccine are seeing their coworkers get the vaccine and have, you know, minimal side effects, and that it's going very well. And so then what we're hearing is that they're changing their minds and then signing up and to get the vaccine. So those are the stories that providers are sharing with our staff. But we do know there are some who are declining, but we don't really know the percentage at this point in time.
Okay. I think that brings us to 3:30, which is all the time that we have allotted today. I wanted to let you all know we are planning another media briefing about COVID-19 vaccine in Idaho at 2:30 next Tuesday, January 12th. We will announce those details on Monday morning. I'll also take the opportunity to mention that Sarah Leeds will be on our Facebook Live event at 10 o'clock tomorrow morning. So you can send us your questions.